Hello everyone, thank you for joining us again, and I'm regrouping today with Tara. Now, Tara Jackson is one of my most long-standing nurses at the CSC, as we've already said on a previous recording, but Tara was given the task of actually talking to people on virtual consultations throughout the whole of lockdown. And the purpose of this really, Tara, is to find out what happened in all that time, and sometimes what we think people are going to be interested in, they're not, and sometimes they're interested in other things that we didn't actually anticipate. So first of all, a big thank you for doing that, Tara, because you really held the fort. And how was it? Did you enjoy doing the virtuals?
Yeah, what has it been, about 9 weeks since March that we started, and we just, like, you just wanted to make sure we re-engaged, or any patients who wanted to chat to us. We didn't know how long lockdown was going to go for, so we just sort of came up with, I know, like lots of other people, came up with the idea of, let's talk about their medical grade skincare, treatments they could do at home, increasing their retinols, getting some retinol tolerance. So that was just easy. You know, we love skin, we're passionate about skincare, so that was great. A big influx of interest there, and then that sort of took that stayed all the way through, because everyone loves good skin quality. But actually, we've had so many patients, I think maybe because of lockdown, we've all been looking at our faces a bit too much. We've been on Zoom calls, everyone's worried about tech necks, and then they were like phoning up and asking the reception team, could I talk to Tara about treatments, what's concerning, what sort of plan could I have up post-quarantine? So then that kind of took over, along with...
I know you're really busy with lots of other consults, weren't you?
Totally. What I don't know about school sculpting isn't worth knowing now, through the help of Ria. That was great. But yes, we've been, you know, bulges have been happening, patients aren't happy with their face, what they're seeing. So yeah, so it was very nice, and I'd like to thank everyone who called us. It was just lovely to chat to new patients, existing patients, come up with treatment plans. That was really nice to have the time without having to do the treatment at the same time. So that was nice.
And I think that's really nice, because sorry to interrupt you, but sometimes it sort of takes, though there is no pressure to have treatment in clinic, I think sometimes when you're sitting at home and there is no pressure to have anything done, you can just take your time to reflect and decide. And I know that when we were talking over those weeks, and that was really nice that you thanked everybody for engaging with us, because that is nice. It's a two-way street when you get to know people very well. But actually, you saw a lot of existing patients for consults. I know that, but you saw a lot of, or you consulted for a lot of new people. So what I'm really interested in is, did you find that people were talking about specific treatments, or did you find there were people more interested in prevention? Were there more people interested in corrective work? What was your overall view, or was it just a mix?
It was a bit of a mix. I would say the predominant concern of everyone I spoke to was wanting to freshen up their faces, accepting that we age. We do age. I would say a real turn, actually, accepting that we age, but really wanting to know how they can soften what was going on, the negative sort of emotions that the aging process does. So, but they wanted that results, but they wanted everything to be natural. So that I felt that actually through virtuals, they were able to have a whole 45-minute conversation about what they didn't like: sagginess, laxity, etched lines, frown lines, sort of mummy mouths, whatever their concern was. But they quite liked that free. I think they really enjoyed just knowing that they were going to talk. I was going to be able to help them educate what goes on, whether it's a bit of bone reabsorption, fat pads descending south, collagen elastin not being so elastic as it used to be. So I think they all loved that. They really loved having that knowledge, and then coming up with a plan. It was a real mix. I had young patients talking about jawlines. They all want to have this sort of gorgeous Kim Kardashian jawline. But you know what? With those patients, I really try to explain that, you know, if we are going to define and beautify the face, and that's what, you know, years ago when we started, Tracy, we used to sort of see a line, fill a line, and then we'd volumize, and now we're supporting ligaments on the face, just how a plastic surgeon would. So I had to say to quite a few patients who had cheek and wanted their jawlines done, not with us, but elsewhere, and wanted my opinion. And I said, it's so important. If you just treat when you're younger, treat the jawline and not ignore the cheeks, which is the most beautifying highlight to treat on the face. You could easily make your face more masculine. You can make a masculine you can make a masculine jawline look feminine. So that was nice. I had older patients. I had quite a lot about lips, you know, lips, young lips, medium, you know, all age lips. So that was great. The importance of explaining that lips are tricky. They're the most dynamic, you know, feature on our face. We have to get them right. They often, as we get older, we need to have support around the lip, not just a pair of lips that walk into a room and everything else is looking, but the lips are out here. You know, all those things. And so it was great.
I think that.
Sorry, I'm off.
You're on a roll. I mean, it's brilliant. I mean,
honestly, 9 weeks. I've got a little tape now. When I chat on that FaceTime, I can just put the tape on. It all just comes out. So sorry.
I think it's really interesting. So, do you think with your younger age category, of course, we go on and on and on now about prevention. Prevention, get something before it's a problem. And I will be honest, I've said it many times, if I had my time again, I would definitely be more focused on prevention, because it is like anything. So you found, definitely, just hooking into what you said, the sort of slightly younger age category. And I want to stress here, we're not talking about doing unnecessary things on very, very, very young people. We're talking here about more engaging with people in preventative measures to actually improve their skin quality. But also, you said about Kim Kardashian, so we can't get away from this. Social media, of course, is influencing a lot the way, the trending of treatments. So I'm really interested to know, how do you feel about that? Do you feel that's a positive influence or not?
I think it's a little bit of both. It can be bad, you know, with someone who really, you know, I've spoken to lots of young patients over the last 8 weeks, and, you know, some very, very pretty, gorgeous, youthful faces, and feeling sort of unhappy with their jawline or their lips. And, you know, as somebody who's an experienced, mature injector, I just look at that face and yes, I can beautify it, but we don't need to go down and start modifying it, changing it, enhancing it too much, that she feels she resembles more one of her sort of influencers. So yes, it's great. But also we've got to remember, and we know, being a similar age, that, you know, this is all airbrushed, it's filters. But, you know, and back to what you say, if you preserve you rather than wait till we have to repair you, you will always look fresher. And those young patients, maybe a little bit of toxin to soften lines, a bit of profiler to hydrate the skin, some really good antioxidants, retinols. That's just enough for them. That's enough to carry them all the way to sort of mid-30s, 40s.
Middle-age.
Middle-age.
I think that's menopausal. I think that's absolutely sums it up. I think that what social media does, it does make information more accessible, which is good, you know. I think it is very useful for people to see these things and what can be achieved. But then there's a level of sort of moderation of that. What is appropriate and what will keep, you know, there is nothing worse than doing carbon copy cutouts. So every face looks the same. It looks awful.
Yeah, they all look the same.
They all look the same and not more attractive. But going on to the category that perhaps we fall into more, specifically me, what were your top treatments, or the things that people perhaps were most engaged with, were most interested in, and what did they feel they wanted as opposed to what you felt they needed? Because sometimes the two don't always
what the patient wants and what they need can be quite different. So, and that's what's the great thing about chatting to patients, educating how the aging process works. So I would say, for most of us, as we head towards the menopause, we're worried about that slightly. When we're not talking or smiling, we can look rather drained, rather miserable.
Resting face.
So we don't like that. So, and then I would just talk about a treatment plan that was suitable, that, you know, whether it be some skin tightening with old therapy, you know, to resuspend the jawline and get some tightening here, whether it be some cheek support, whether it's supporting this area here that starts to, as we get the little bit of bone shrinkage starts to come in, it's important not to just concentrate on filling the lips. So yeah, they and I would say patients who were existing patients just re-engaged and said, yeah, let me book myself in for my next oral therapy. Most patients are having oral therapy every sort of 12 to 18 months, depending on age. And then, you know, a couple of weeks later, I think a lot of them have booked in for some, you know, some dermal filler support.
Yeah, that's really interesting. Again, going back, because I think it's very important, and we're not averse to recommending surgery to patients at all, even though we are a non-surgical practice. There are some people who want and need a surgical procedure. But did you find that a lot of people were definitely trying to get that really great wow look, but with a non-surgical solution?
Totally. I think most patients are beginning to realise that actually, as practitioners, we are looking at the face like a plastic surgeon does. Years ago, we didn't. No. Now we do. We know we can support ligaments that are allowing the face to drop and sag, and we look sad and tired. But we now know that with filler correctly placed, will give you that little bit of tension, not fullness. It's not that, you know.
No, it's not that.
It's not here. I'm quite cuddly, so don't think this is not filler. This is my own natural filler. But this is, you know, this is where the tension needs to be, and this is where the plastic surgeons would be. So along with skin tightening, improve that collagen, improve that elastin, get it tight again so it's all a bit firmer, and then correct filler. Then maybe a little bit of toxin. Just, you know, the aging process will create negative lines on the face. So if we look a bit stern, we look a bit worried, all those harsh, it's harsh. So we can soften all that. We don't worry about everything. We don't try to airbrush you. We just soften what is negative. Yeah. And we can easily do that with technology, some oral therapy, some Tixel, the right amount of toxin, right amount of filler, and good skincare.
Yeah, said beautifully. I said beautifully. And I think I always say, again, it's not necessarily always true, but there's normally the magic sort of triad of treatments, the top 3 things. That, and remember now we're talking again about more the middle-age, perimenopausal, menopausal age category. And we're talking primarily about women here, of course. But actually, most people, if you're trying to prioritize need, there'll be the top 3 big wins in most women in that age category. And number 1 won't necessarily be a muscle relaxant or toxin. Number 1 will normally be a filler skin tightener. But the 2 together, and I always say that the filler to support the ligaments more than volumize, more to give support, and then that redraping and the tightening of the tissue with the oral therapy gives great results, and often gives much, you know, really, really wow, a real wow factor. That's really interesting. So in summary, I mean, again, it was really an interesting experience listening to you and what people were saying to you over this time. So was there anything extra from your experience over these few weeks that you wanted to say? It seems like it was really interesting because you've got a real mix of age of people.
Yeah, I think we're going to be busy. Obviously, we know that with looking at the diaries. But a lot of patients spoke about cool sculpting.
I was about to say, did you get a lot of body
I don't think everybody's kept 2 meters away from the fridge like I should have done. And I think cool sculpting is going to be there. There's little, maybe lockdown bulges that might have appeared. So I think we're going to be very busy with that, you know, along with everything else.
I think it's true. I think it's, you know, look, we're flesh and blood and we're human, and it's a long time to be, you know, it's a long time to be isolated away from people. And certainly looking at the bookings, yes, a lot of people are coming in for cool sculpting consultations, which is interesting. But a lot of a mix, as you say, a huge mix across the board of people coming in. And again, you know, the skincare still remains a big winner. As we said, for Philo.
Yeah, and you know, it's funny what I've really learned, what I've got really good at when I'm saying, when I see you in June, or sorry, when I see you in July and August, can you take a picture of your skincare? We often ask patients to bring in a picture of themselves a couple of decades ago, don't we? Just to see how the face was. And now I'm going, I will need a picture of your face, I need a picture of your skincare. So I just think, actually, that just makes it really easy. So I can work out what I can cherry pick, what's great, what we can add in, what we don't need to necessarily add into there. So yeah, that's all been great. That's definitely what I'm saying to everyone. Photo of your skincare, photo of your face, and no makeup. That's what I've told everyone to come in like.
That's really, really interesting. So now leading, so we're all going back to work. As you know, you mentioned that we're all back at the beginning of July. We're all back in our PPE, looking rather different, but nonetheless, we're all the same behind it all. What's the treatment, just as a finisher up, what's the treatment you're most looking forward to coming back to do? Or is there no one treatment?
Oh, there never is one treatment with me. I like following that journey with my patients. So if they are wanting to soften jowls, whatever that treatment requires to soften jowl, whether it's still a little bit of dermal support, whether some muscle relaxants or some oil therapy, I just like to do the whole journey with my patients. So I love all the treatments. I'm a bit, you know how much I like lips, but I kind of like everything. I just like to follow that journey with the patients and see them looking sort of refreshed, the best version of themselves. So yes, maybe it sounds a bit cheesy, but that's kind of, I don't want to have
I only think it sounds cheesy if it's not true, and I know that is very much
it's definitely true.
Your ethos of treatment for patients. So again, a big thank you, Tara, for what you've done over the past few weeks, and the patients have loved their virtuals with you. I've got some amazing feedback.
It will be nice to come back to work though.
I'll remember that when people say that to me.
I don't think I could just work in an office all day long. I need to be with my patients. It's been really good
fun listening to you. Thank you very much, Tara, and I'll see you at work.
I'll see you tomorrow. COVID
see you tomorrow. Yes, indeed.
Bye.
Thank you so much. Thank you, everyone, for watching. Bye.
Bye.